Hi, I'm Dr. Rob Danoff for RA Health Medical Mythbusters. You ready? Okay, is this a myth or is this a fact? If you or a loved one develop tremors, shaking of the hand, trouble with your voice, shaking of your leg, unfortunately, you're probably likely to develop Parkinson's disease. Is that a myth or is that a fact? Well, today, who better to answer that question than our Director of Outpatient Neurology, Dr. Brian Kelly. Dr. Kelly, is that a myth regarding a tremor in Parkinson's disease, or is that a fact?
Well, actually it's a myth. As it turns out, there are many causes of tremor. Some of them are associated with certain medical conditions and can be serious, but there are a large number of tremors that are by benign causes.
Can I ask you, what exactly is a tremor, so we all know?
Well, a tremor is a rhythmic oscillation of some portion of the body. So it could be your arms, it could be your head, it could even be your voice. Typically it is a rather rhythmic, repetitive movement of a limb.
So would it be like something like this, and people, they can't control it?
Well, some tremors can be controlled, at least temporarily. A more common cause of tremor is something called essential tremor. That can run in families. It can occur at any age. Now, typically it occurs when a person puts their hand out and they have a fine, rapid tremor. People may notice it at times when they're holding an object and it's starting to shake on them, or have difficulty with pouring or, using food and utensils. And they can willfully try to stop it for a period of time, but they can't keep it away for very long.
Well, so how can a person tell whether all of a sudden it's because of nerves or maybe there's something else going on? Would it affect both areas, say both hands or both legs, or can it just affect one? And what should they do if they find themselves with something like that?
Well, I think whenever something new comes on, if you've never had a tremor before, you should seek medical evaluation. Tremors can be due to any number of things. Certainly there are certain diseases like Parkinson's, but there are conditions like essential tremor, which can be an inherited condition, that are not serious but still can be debilitating in some people. When you have a tremor, if you've never had a tremor before, seek medical assistance. A neurologist is usually the best place to go because movement disorders, including tremors, can be treated. There are medications, there are surgeries, there are other types of therapies that can be used that will help in making this a more livable problem.
So if someone develops this, is it something that is more of an older age, or can young people have it? What do you see most commonly?
Well, that again begs you into the question of what type of tremor is it?
Okay.
Because there are younger people who can have what's known as essential tremor. This is often a family-related tremor, but not necessarily so, in which you will have a fine, rapid tremor of the hands. People will have this at any age, but it comes on and can get worse as you get older. This is quite different than Parkinson's disease, which of course is more commonly associated with an older age group, though some people in their younger middle ages may develop it. That's an uncommon thing, but we've seen Michael J. Fox and other people like that who develop it at a younger age.
So basically, so everyone out there doesn't worry, if you get this type of tremor or a loved one, it doesn't necessarily mean that it's Parkinson or some other serious. There are some times that it just happens, and it doesn't mean it's serious. But if you're concerned about your health or your loved one, maybe you have a neurologic concern or an issue, or that tremor, for more information, to see Dr. Kelly or to come to RA Health, go to yourrahealth.org.